Hey everybody, this is going to be a little guide on your GLP-1 medication. So that's Semaglutide, which is Ozempic, Wegovy, and Tirzepatide, which is Mounjaro. So when you get your package from the pharmacy, you're going to get your syringes, you're going to get a box with the medication in it, and your medications are going to be inside, okay? I got a little eager ahead of time, so let me show it. So you can see what there was a cap on top of it here, and what you want to do is you want to, see here, pop the little cap with your thumb when you get it so you can get to the rubber stopper, okay? And now you'll be able to use your medication, okay? So that's your semaglutide there, okay? Now, when you get your syringes, you're going to have an orange top and orange bottom, so you just got to remove both and top and bottom, okay? Now, with the semaglutide medication, most patients, okay, are going to be somewhere between 25 units to 40 units a week. Okay, we do have occasional patients up to the 50 unit mark, and we do have some patients who are less, about like the 20 unit or 15 unit mark. That said, when you first start your dosage, I tell you everybody the first time do only 15 units the first week, just to acclimate the body, because a lot of times if you start at like a 25 or 30 units or something like that, you're going to start feeling nausea. You're going to feel nauseous or constipated, so to acclimate the body, or the stomach will feel kind of tight. So just to acclimate the body, start the first time with the 15 unit mark. As far as with Mounjaro, most patients are, you guys go straight to the 50 unit mark, the 50, it's a different amount and dosage for you guys. But you guys would just do to the 50 unit mark and do that once a week. We do have some patients that we need to give a little bigger syringe, which is like to do the 75 units. I don't think I have anyone past that, but it's always between 50 to 75 unit you guys inject, so it's a little different syringe. But nonetheless, it'll still be same small needle like this. Now, so what you're going to do is when you get your vial, what you're going to do is you're going to put some air into it. So we're going to say, like in this case, I'm going to say I'm a first-time patient. I'm going to put up to the 15 mark, and then what I'm going to do is I'm going to put some air in it and push some air. The reason why I say push some air is that it creates a little back pressure in the thing, and it makes it easier to draw out. Okay, and then you'd inject. Now, I do have my vial that I just I do have my other vial here, and this one is there's a little bit left in it. So anytime I have a little bit left, what I do is, you see this one's a little different, because what I did was I took a little plier and I crimped out the metal and popped it off. Sometimes the rubber stopper comes off with it, but so I can get all the last bit of drop of the medication, you know. So let me just open this up, and I should have around 25 units in there, because usually I know that's how much I'm injecting. So let's see here. Oh, there we go. Actually, I got a little bit. It's a little air bubble there. So I just flick it, and I just flick out the air bubble here. There we go. And there we go. Perfect. 25 units. Okay. Anytime I recap, hold from the top and recap to the top. Okay. So don't hold from the side, just in case anything pops through. Hold from the top, recap, and now you can discard or use or save for a later date. That said, as far as the only thing I do recommend with the semaglutide or Mounjaro is B12. You can do lipotropic injections, which has methionine, choline. They might have some like pyridoxine, which is B6, and things like that as well. But really, those other things help with the fat burning. But it really is the B12, because it just it tends to be harder for patients to absorb B12 when you're on the any of the GLP-1 medications, so just because it affects the intrinsic factor in the stomach, which B12 goes to the stomach, needs to bind to intrinsic factor, and then goes to your small intestine, and then it gets absorbed. Without intrinsic factor, this body does not absorb B12. Outside of that, I hope this was a helpful guide. If you have any questions, feel free to reach out. Take care, guys. Bye.